Hello, I'm Jace Tanner, reporting from Vancouver's Downtown Eastside for rabble.ca. Earlier this week, I met with Shane Simpson, former MLA for Vancouver Hastings and former Minister of Social Development and Poverty Reduction. Simpson was first elected in 2005 and only recently retired in the fall of 2020. In his youth, he lived in Vancouver's Downtown Eastside and was active in community development. We discussed a number of things, including BC's poverty reduction strategy introduced in 2018, the $300 supplement to social assistance announced in response to the pandemic, and what's needed in order to break the cycle of poverty. We also talked about the issues in Vancouver's Downtown Eastside and what the next steps are in addressing these.
I've always kind of acknowledged and credited what I learned living in Raymur, the engagement with the militant mothers, watching that process. That probably inspired me more than anything else to get involved and be socially active, and my activism came from that, my work in the labor movement, and ultimately led to, getting elected and spending 16 years as the MLA for Vancouver Hastings. But I go back and I was inspired. This group of women at a time in the 70s when single moms on welfare were welfare moms, and the advice they got was go find yourself a man who'll take care of you and your kids and be thankful for it. And they learned through that process that if they came together and they worked together, they had power. And this was a very, very smart group of women, and they made that work to do the overpass, the issue with the militant mothers. But maybe even more so than that, they built the Raycam Co-op Association, which was a very diverse, multifaceted organization that supported the people living in Raymur, and ultimately built the Raycam Center that's on the corner of Campbell and Hastings. A remarkable group of women, and they probably inspired me more than anybody for the path that my life ended up taking. I ended up getting, I think my first paid work was for an organization called the Vancouver Welfare Rights Organization. It was created through some project, law student project out of UBC, but they brought some community people in, and I ended up getting one of those opportunity for youth or local initiative $100 a week jobs that started me on the way to actually paying for groceries by being a social activist. We had argued for years in opposition that British Columbia needed a poverty reduction strategy. We're the only province in the country that didn't have one. We had the highest rates of poverty in the country and close to the highest rates of child poverty, while we also had the strongest economy. And so it was one of our commitments, and we got to work on that shortly after I became the Minister of Social Development and Poverty Reduction. And we took our time to do that because one of the things that I knew was those people who lived in poverty, people living with disabilities, people who were street entrenched, single moms, their voices were never part of the conversation. It was the academics and the politicians and the social workers who discussed this. We didn't talk to the people who lived it every day. So we traveled the province, and I went to every one of the locations, and when I didn't go, Mabel Elmore, who was my parliamentary secretary and the MLA for Kensington, she attended those. So I was there for every one of those sessions, and we heard firsthand and produced a What We Heard report, and then ultimately the strategy that called for the reduction in poverty. And in theory, we've met that challenge. Actually, by the time I left, we had probably met our 5-year goals early, though I'm sure it's all been turned on its head by COVID, and we'll see poverty numbers that are back up. And they also made some changes to how they measure poverty that were smart changes, and they probably will again increase the numbers because they talk more to the housing challenge, which is huge. You have to understand that poverty, about 40% of people who live in poverty are the working poor. And then seniors make up a portion, and obviously persons with disabilities. So we had made significant progress, mostly because we didn't see this as something that my ministry was going to do. We realized very quickly that if we wanted to have success in reducing poverty, it had to be an all-of-government initiative or it wasn't going to work. We needed housing to be at the table. We needed labor to be at the table, the minimum wage and employee rights. We needed mental health and addictions at the table. We needed health. We needed education and post-secondary if we were going to give people the training they needed to break the cycle of poverty, which had to always be the objective. Throwing money at it, and I don't want to be cavalier about this, but throwing money at it, you just chase that money. You have to figure out how do you break the cycle for a large piece of those folks. And then what do you do with the folks to support the people who just, their reality is their lives aren't going to change that much and they need support. So we made really good progress in a number of those areas. We brought the child opportunity benefit in, significant support for kids, the minimum wage increases, the biggest investments in social housing that are ongoing today that have been supportive. People would say there's more to do, and I wouldn't question that for 1 minute. We brought in changes around welfare and disability supports that both made it easier to access programs, made it less punitive, put some more money on the table, not enough, but more money on the table for people. So we touched it in a bunch of ways and enhanced the education programs. One good example of that, kids aging out of care. We created a program where they could get free post-secondary. The government said, we are essentially your parent. We will support your education until you get a degree or a college diploma or whatever. And that's made a huge difference for thousands of young people who, were just as likely to age out of care and end up in the Ministry of Social Development Poverty Reduction. Now there's opportunities for them to learn some skills and do some things they want to do with their life. Well, what we did, we achieved the objective very quickly. The objective was, and it's in the legislation, was to reduce child poverty by 50% and reduce overall poverty by 25% over 5 years. We achieved those goals in the matter of about 3 years from when we started to measure. Now, I don't know what that looks like as it goes sideways. I think that we will get back to where we were. I think that we're going to recover from this in economic terms. The question is how people got hurt in that interim and what does that look like moving forward. So we made good progress there. Now, one of the things is this is always a bit of a mug's game because you have a poverty line. We adopted the federal government's line, the market basket measure. Probably of the 3 or 4 options, it's the one that everybody gave us advice and said it's the way to go, but it was insufficient. It never covered the cost of housing in the way that it should. There's now a new market basket measure that we'll look at for next year. It will be in place, and it has significantly increased housing costs or the housing aspect of the need, what you need to survive. So it's going to add some people, but the good thing about the legislation is it's law now. It says you have to achieve this. It says there has to be an annual report produced every year to go to the legislature and be made public. There's an independent committee of advisors, mostly people with lived experience and advocates, who get to write a commentary that is free from interference that becomes part of that report. So part of it is transparency and accountability. We had a government in British Columbia under the BC Liberals that their objective around the ministry that I had was manage the costs and try to stay out of the newspaper because the story is never good. And other than that, don't get in the way of the important work of government, which is, cutting down trees and building real estate and cutting taxes. The Downtown Eastside is a unique neighborhood of all the neighborhoods in the province. One of the things we did is we provided support to local organizations and local governments. We said to them, you come together as local anti-poverty activists and local governments and do local plans, because poverty is not a monolithic thing. It's unique, it's different for different groups of people, and it's different in different parts of the province. Housing was the issue everywhere, but in some places after that, it was food security or it was employment. The only real consistent across the province when we did the consultation was housing. So, and in the Downtown Eastside, it's a complex community, and it's a community where there's a significant number of people, not the majority, but a significant number of people who have very intense dual diagnosis, mental health and addiction issues, and very extreme in some cases. And you start saying, there's no, giving those folks, money will help them, but you also potentially create a risk. And we know that. But how do you house folks? And you house people in that community where their network and their friends are. Do you find ways for people who want to leave the community? Can you move them out of the community if by their choice and house them somewhere else? Do we have the mental health services there? This is a very complex community, and I think there's a couple of problems that have really jumped out in the Downtown Eastside. One is the three levels of government have not been able to get it together to kind of speak with one voice and decide how to move forward. There's always been this notion of putting somebody in charge who could work there and could fix the problems. Well, I'm not sure how you do that, because you've got three different jurisdictions who don't cooperate all that well all the time. And how do you get one person to herd those cats? Pretty hard. The second thing, and this is something that I worked a lot on, it became clear to me very quickly in the Downtown Eastside that probably since the end of DERA, the Downtown Eastside Residents Association, that was the last organization that really was a strong voice for the people who live in the community. The Carnegie Community Action Project has done some good work, but nobody's ever replaced what DERA did. And I've always felt the people who live in the community, other than some of them who work for some of the agencies and support groups, they've really not had a place at the table in this conversation in the way they should. I think we have to figure out how to fix that too. Well, I think that if you give people money, and people don't have enough money to live on, so that's apparent. But if you give people who are struggling with mental health issues, struggling with addiction issues, more money, you potentially create the risk that people are going to hurt themselves, especially with this toxic drug supply that we're facing, the crisis, the opioid crisis that we see, and that obviously has hammered the Downtown Eastside. When we did the $300 crisis supplement and we increased people's income by $300 for 9 months during the COVID period, that was something we watched very closely to see whether that was going to create a problem. It created some bumps, but it didn't create a crisis that made us rethink that. But it's not out of the question that it could have. So you just have to understand that dealing with poverty, breaking that cycle, is not simply about dollars. It has to be about how you change people's opportunities to have the lives they want. And for a very small group of people, how do you give them the supports that allow them to be protected without restricting them too much? I'm not sure about that. I don't necessarily believe that's true. I don't have any inside information, but I don't believe that's true. I think what you're going to see is the budget's coming up in a month or so, and that supplement was that. I mean, people talked about it like it was a rate increase, and I spent a lot of time as minister saying it's a crisis supplement. It's not a rate increase. Rates come with the budget, and there's a budget coming. The Premier has said that he supports a rate increase. I know the minister is working on it, and as is the finance minister. So we're going to see here pretty soon when the budget comes. I think the budget's coming in at late April, maybe early May. I know it's delayed this year. I don't actually anticipate that $150 will be reduced before the budget comes, and then whatever the budget is will transition in at that point. I think it's probably in some ways one of the biggest successes for the ministry was a focus I had on how do you change the culture of this ministry. I'll give you an example. When I first came to the ministry, there's a correspondence unit, and as you can imagine, there's a lot of people who write to the welfare minister to talk about things positive and negative about the system. And so there's a correspondence unit that writes replies for the minister to look at. And I kept getting these replies that started with a paragraph that essentially said, we're the ministry of last resort and you should feel grateful for what you get. And I just sent the letters back and I said, well, I'm not signing these letters, so you can take them back, because if I ever see that in a letter, it's not getting my signature. We're here to support people. We're here to help people, to create opportunity for people to have the lives they want and to be able to realize some of their dreams. And that, I'm not Pollyannish about this, but that's where we got to go. And I went around and spent a lot of time going to ministry offices and talking to frontline staff and saying, this is what I'm looking for. And the staff grabbed onto it right away. They didn't want to be bean counters. They didn't want to just be saying no to people or patronizing people. So we started to change that culture, and I actually consider that one of the biggest successes. It was highly satisfying for the people who work in the ministry. It also was better for the people who receive support. One of the ways I kind of test flew that is I contacted a bunch of my colleagues, because one of the ways you tell this, I said, your constituency offices, are you getting more calls or less calls about my ministry, and what do they look like? And let's track them. And they were way down. And that told me that not that we were giving people tons more, but we were treating people with a level of respect that they deserved. And that was a big change. In terms of things that have not, that there's more work to do, obviously the amount of money that people have to live continues to be a challenge. Housing support continues to be a challenge. The government has made some progress in those areas. I didn't take it far enough, and the government has to continue to work to take it farther. Well, I think that it depends what people think they see when they see poverty. The Downtown Eastside is a small piece of this. We're talking 500,000 people living in poverty in the province, and the media focuses very much on people who are really struggling and challenged in communities around Main and Hastings. So I think that portrays it differently. I think that if you focus your initiative, you can make some progress. It's one of the reasons, quite frankly, when we did the poverty plan, we did overall poverty and child poverty, because I knew that as long as we put child poverty in, that always gets a response from people. People are sympathetic that we need to deal with child poverty. Kids didn't ask for this. Persons with disabilities, though there are challenges there, but persons with disabilities, the same thing. I think you can make the argument for the working poor. It's a pretty good argument to say, hey, if you go to work every day and you work your 35, 40 hours a week, shouldn't you kind of be able to afford at least a modest standard of living? And people can't in lots of places. That stuff resonates. but there's no question that we still have a sentiment of the good poor and the not so good poor. Those people who, who are deserving and undeserving. And we need to be very careful about that, because we've seen how that's exploded in other provinces and hurt some of the people who are in the most desperate situations. One of the things that I'm really happy about that we did is very early in our term, and it was part of my responsibility, we put in place the Basic Income Expert Panel. 3 very distinguished progressive academics. I gave them 2 years and a significant budget and said, go away and answer 3 questions. First of all, could you do a basic income in British Columbia? What would it look like, and does it make sense? Second was a question around, is a basic income a transition tool for technological change? And the third, and the question that really was most important to me, is I said, take a look at all the income support programs in our province and the ones the feds deliver in British Columbia, and give us some recommendations about how we could do that better using some of the principles of basic income. That report's released now. It's a remarkable piece of work. I think the best piece of work on basic income anywhere. It says what I believe is true, which is a universal basic income. If you really want to make it global, it makes no sense. It's not a good idea. You can use basic income in a targeted way very effectively, but it doesn't make much sense as a universal program. It's not effective. But they then created 65 recommendations that deal very much with those issues around how income support should change. I know the government is looking at those seriously. I'm starting to hear some engagement in the community, and I really hope that becomes a debate about what do we do moving forward? What should a social policy framework look like moving forward? What is the role of government to provide support for people, and how do you measure that support? Whether it's, if I provide you with affordable housing, then that changes how much money you need to have. If I can create educational opportunities for you that create the opportunity for you to maybe go and build a career that, where you can generate greater income, that's great. So I think all of that is there. And that piece of work on the basic income that the expert panel did, I think really kind of lays out those bigger initiatives and what they could look like. And I'm hoping it doesn't get lost or put on a shelf, which has happened with too many government reports. I think it makes sense. I support that. I think that we need to figure out how to do it and make it happen. And the sooner that we can do that, I think we have a much better opportunity of dealing with the crisis in front of us, and taking the money out of the game that leads to a lot of the criminal activity, of course. Now there will be consequences for that, but I'm very much a supporter and a proponent of a legal supply, and nobody should go to jail for a health issue. Yeah, it's a community I know pretty well, and I would agree. I think there's a real sense of community there. I think there are a lot of people who have lived in that community for a very long time, and I think of the challenges. I go back growing up as a kid there, and my mom and I, we used to go to Woodward's, and we did our grocery shopping on Powell Street and at the Woodward's food floor. That's kind of what we did. I'd often think that the big thing, I came along to carry bags of groceries because that was my job, but I could usually get a frosted malt at the snack bar at Woodward's on the food floor if I was lucky. But I think that there is a real sense of community there. And I think that we have to try to maintain that. I had responsibility for ending the encampment at Oppenheimer. and moving folks, and we moved people into hotels and elsewhere, and then obviously after that sometimes Strathcona happened. But a big part of the challenge there was trying to understand the sense of community that had been built in Oppenheimer. And there were 3 or 4 groups within Oppenheimer that coalesced together. And we worked really hard as best we could to try to keep those folks together and make sure, well, we've got a hotel, so we're going to try to move this whole group of people together into that hotel so that they still have those relationships. I think sometimes that we don't acknowledge that sense of community that happens. We look at this from a distance, and it's not. We're not going to solve the problem by ignoring the reality that there is a community there. We're not going to make it go away, and I worry that for too many people, it's about make this go away because I'm really uncomfortable looking at it every day, more than how do we fix this. Well, we certainly, part of it was we had an opportunity. The park board had jurisdiction. The city could not overrule them. We had looked, and we couldn't have overruled the park board either as the provincial government without a legislative change. And we weren't going to do that. But when the state of emergency was put in place for COVID, there was an opportunity created there. We also had a lot of health workers in Oppenheimer working in the community through the Ministry of Health, through my ministry and that. And we knew that we were right on the bubble of a potential crisis there. The virus didn't catch, but it could have caught very easily. We were also being told that the amount of predator activity was increasing. And about 10% of the people, there are a couple hundred people in Oppenheimer, we knew about 10% of them were not homeless folks. They were predators from outside who were there in tents. They were selling drugs. They were looking to involve mostly young women in prostitution. They were extorting people. And we wanted to deal with that. It was just becoming increasingly unsafe. So we used the opportunity of the state of emergency to basically overrule the park board and say, we're coming and we're doing this now. And we're going to do it quickly, and as we did in Victoria, at the parks in Victoria. It was just an opportunity, and it was time to get this done. Oppenheimer was not getting better, and it wasn't going away. Yeah, and Strathcona, the interesting thing with Strathcona, a couple of the people who were kind of the motivators behind Strathcona, first they went to Crab Park and looked to locate there, and then ultimately ended up in Strathcona Park. It was largely a different group of people, because I followed pretty closely what happened to the hundreds of people that we housed. About 90% of them kept their housing. They stayed. About 10% left. It just didn't work for them. And there was a group of people at the outset who just didn't want to go inside, and that's just what they wanted. So it was a different group of people, I think, in Strathcona. Same issues, different group of people there, and I guess it's just a reflection of how big this problem is to solve. Well, and we have seen COVID spreading in the Downtown Eastside and in the community. There certainly is a challenge there. I think Strathcona is going to be gone in the next few weeks. The minister responsible has said that his intention is to have everybody out in April. And we're seeing it now as they're starting to tighten it up and shut down areas of the park to turn them back over to park use for people who live in the community. So we'll see it done. I guess the big challenge is once Strathcona is closed and the folks who are there have been given other opportunities, which has to be part of the fix, is there another Strathcona to come? And I don't know. And we always, as the provincial government, we're critical of the federal government for not putting housing money up. The federal government hasn't had a meaningful housing program since the early 90s. And it worked then because they were matching provincial dollars. So we had 50-cent dollars, so we were able to build twice as much. It's been a challenge. The federal government had talked about housing dollars, but money never arrived. I think it's got a little better now. I think the city has done some good work, and they deserve some credit on the work they've done with the federal government to squeeze some money out. But if we're going to deal with the housing issue, and certainly at that level, then we have billions of dollars of housing to build, and that's just the reality. And that means that the senior levels of government have to make those investments, and the local levels of government have to either provide land when they can or expedite the building. Because part of the challenge, of course, is other than doing modular, which you can do in 6 months, most housing, it's 2, 3 years, 4 years from the concept to the point where you're giving somebody a key. And that's too long. Well, poverty-wise, there is a discussion around basic income that has kind of erupted across the country and elsewhere. The CERB, which was the benefit, the federal government, the $2,000 a month benefit the federal government put in place, that resonated for a lot of people like a basic income. So I think there's going to be more discussion about that and about what that might look like moving forward. And that's probably a good thing, because it will motivate the discussion about income security. And what does income security look like, whether it's a basic income or not? Most provinces will want nothing to do with it. The feds will have to decide what to do. And one of the things we learned is that just about impossible for a provincial government to do a basic income without it being a national program. And so I think that has to happen. I also think the housing issue, that we need to see what do the investments look like moving forward, and we need to be aggressive in building the social housing that we need. Make some decisions about that. I think the comments from earlier about what we do about the opioid crisis and about safe supply and about access to that, it's coming. I get that sense that we're moving there, but we could move a little more quickly to get there, and that will be critical moving forward. And we need to make some decisions about, and I don't know whether this is an accurate number, but some would say that there are about 300 or 400 people in the Downtown Eastside who are in deep, deep crisis. They're manic. They have other serious issues. They are a risk to themselves and a risk to others because of the complexity of their health issues. And we need to figure out, how do we support those people, and what does that support look like? And I think that's going to be a difficult conversation. You always get are you going to reopen a Riverview or something like that to address that? I don't know that that's the answer, but we need to find a way to ensure those 300 or 400 people are safe, they're not a risk to themselves or to anybody else, and that they have the best lives they can have. I think that what's absolutely critical to the success in the Downtown Eastside is going to be how the community comes to the table. My experience with community development for 45 years has been that it's always worked best when the people who are most directly affected are in fact the people who have a strong voice at the table. That's what the Militant Mothers did. When they asserted themselves and said, we are now part of this conversation and we're not going away, they affected real change. I do think that has to happen in the Downtown Eastside. There are some remarkable advocates in that community, people I have a ton of respect for, who I don't always agree with, but I have no limit in my respect for the work that they do and their commitment. we have to figure out how do we get those people to a table that's a serious conversation, and it doesn't exist today. That has to happen, or I think it'll be very hard to address those issues as long as the people who are affected aren't heard. You know, in the disability community, there's a saying, nothing about us without us. And they are adamant about that, and they should be. And there's real progress, but it's made because those voices are at the table. And they demand to be there, and they demand to be heard. We need to figure out what's that table look like to get local community voices to it, and to make sure the people who have to be part of that conversation with them, whether it's politicians or bureaucrats or academics, are at that table with them too. I think that has to happen if we're going to see the change we need. The other comment I would make is that we all know that gentrification continues to squeeze the Downtown Eastside. The actual footprint for the local community is probably half the size of what it was 10 or 15 years ago. It's part of the problem because it's condensed people into a much smaller area. And we need to make sure that whatever plans come for the Downtown Eastside, they recognize that the people who have called this community home for a long time continue to have that ability to call it home and don't get squeezed out because of the value of real estate. I hope so. You know, I haven't quite landed on that. I sort of pulled the covers over my head after I got out of politics, and it was easy to do with COVID to pull the covers over your head. And I'm doing a little writing, and I'm taking some writing courses and trying to be better at that. But I do hope that I can find a way to continue to contribute. One of the things that I enjoy to do is to help solve problems. And there are no shortage of problems out there, and I don't need a job, but I wouldn't mind helping to solve a few problems.
You've just heard from Shane Simpson, former MLA for Vancouver Hastings and former Minister of Social Development and Poverty Reduction. We talked about addressing poverty in BC province-wide, the issues in Vancouver's Downtown Eastside, and what steps are needed now. Please check the link in the YouTube description to find out more. Thanks for watching.